So we continue, striving for developing newer treatments, novel treatments for patients with Waldenström's, as we need to treat these patients after they, progress on other agents. And I think at this time, the most encouraging, there are three encouraging approaches. Number one is BTK inhibitor combinations. So now there's a number of studies using ibrutinib, acalabrutinib, or zanubrutinib, and they're combining these agents with either chemotherapy, proteasome inhibitors, or other medications like BCL2 antagonists. And the reason for this is to provide treatments that are finite. So BTK inhibitors are extremely effective, but they're expensive, and patients need to take them indefinitely. So we have patients who take these medications for years, and that could, be of a high cost to society. So developing, using these very potent agents and kind of designing a treatment that is fixed, I think could guarantee a good outcome for the patients, lower toxicity, and hopefully lower cost. So there's a number of studies in the United States and Canada and in Europe looking into these combinations with fixed duration with BTK inhibitors. So that's the first one. The second approach is a third generation of BTK inhibitors. So there is the BTK inhibitors that we have currently are called covalents. It's just the way they bind to the molecules. So there's a new generation of BTK inhibitors called non-covalents. So bind to the same BTK molecule in a different way. So when patients are progressing in the covalent BTK inhibitors, there's already some data out there that shows that if they get exposed to a non-covalent BTK inhibitor, then the response can be regained and patients can continue benefiting from treatment. So we have two agents here, pirtobrutinib and Nemtabrutinib, and those are oral agents as well, and the data is actually being accrued at this time, accumulated at this time, but it looks very, very promising, and I think that is also the future, and combinations will follow shortly, I am sure. The third approach is immunotherapy. And in immunotherapy, we have three big groups. We have the antibody phospholipid drug conjugates. We do have what we call the bispecific T-cell engagers, or BiTEs, in the CAR T-cells. So at this time, there are two immunotherapies trials running. One of them is with the antibody-drug conjugate called loncastuximab that is targeting CD19. This is an ongoing study. We don't have any results yet. The other study is using a medication called CLR-131, which is a phospholipid drug conjugate. It's a radioisotope. It's a completely novel mechanism of action. It has been given breakthrough designation by the FDA. So that study is also ongoing. And there is a CAR T-cell program that is being also planned to start in many parts of the world, in very early 2024. So again, a very exciting time for clinicians who do clinical trials and for patients in need of new agents in the field of Waldenström's macroglobulinemia.